Good morning, everyone. So nice to be with you again. And thank you to Minister Darrell and to Richard Auckland for inviting us to join with you this morning. As past chair of the In Out of the Cold, it's my privilege to have with me today Laurie Fitzgerald, who's the executive director. I'm going to begin with just a very brief outline of what happened beginning in 2008-9 and on until our hiring of Laurie last year in October as executive director. We've been so fortunate during this time of COVID-19 to have her expertise, and I'm very pleased to have her join us this morning. As many of you may have heard of the In Out of the Cold, Central United Church was part of a group that in 2008-9 was approached. I think there were about 15 approaches made, and during that time, Ken Brooks, Reverend Ken Brooks, who's an Anglican minister and also the lawyer, executive director of the Elgin Oxford Legal Clinic, was along with Heather DeBrun, who was the executive director of the Canadian Mental Health Association, were looking for a place to help homeless people be housed. Shirley Broadbent and Ray Broadbent of Central United Church listened to their plea, convinced the church council that this was exactly the right mission for us, and away we went. So in 2009, from November 2009 to April 2010, we began. We used the scripture Matthew 35 verse 25, "For I was hungry and you gave me food, I was thirsty and you gave me drink, and I was a stranger and you welcomed me," as the basis for our welcoming our homeless guests. During that year, we had a few people, 10 or 20 or so. Last year, 2018-19, we served 232 guests. 119 of them stayed overnight, and we were sleeping up to 30 per night in the gymnasium. You will note that the reasons for homelessness had changed. In the early years, it was no work. And as we come into this current year, it is alcohol and drug addiction. It is difficulty with family, child abuse, early abuse, women abuse, that kind of thing. So the needs are much greater in the mental health area. We would like to share with you some information about homeless people today, because I see in Toronto there's a protest about homeless and there's a protest for homeless. I'm going to ask Laurie in a few minutes to provide some information on what's currently happening, but truly it has become an issue that is more broad than what we began with in 2009. About 2013, I began to notice some of my former students. As I see the names scroll on for the churches who have joined, the 4 churches who have joined together, I see many of you have been educators in the field, and you'll know that I'm speaking about our behavioral needs children and students, older students. In fact, we had 200 students from 16 to 21 at the START Center at the Psychiatric Hospital. We had very good relations with CPRI, Children's Psychiatric Research Institute in London, where we just needed to call and they would come right over and help us with our children who needed help. And all of that was changed in about 1982 when we began to do what we called integration. And since that time, the needs of the people on the street have become very apparent, and when I saw some of the people attending the In Out of the Cold, I realized that I had had them in behavior classes or known of them through very individualized programs. So as I began to ask questions, I should forewarn each of you that as you begin to ask questions, you end up to be chair of the board, and that's exactly what happened. The Inn had goals to meet and support these young people, and we had 132 volunteers helping us. Many groups like the St. Thomas Railway City Rotary Club, the Kinsmen, the Little Lions, the Leos came and helped us. We had children from New Vision Church where the Boy Scout and troop came and helped pack backpacks for comforts for the Inn guests. And as we evolved and changed and involved more people, we were looking for more help, and lo and behold, we're able to raise enough funds to manage to have the proper staffing. And with that, we ended up with our favorite executive director, Laurie Fitzgerald, who comes to us with a background of having served in St. Thomas through Fresh Start, a program for mothers and children, through the Salvation Army in London with the Centre of Hope, and has all kinds of skills just at the time we needed them. So I'm going to turn it over to Lori, who's going to bring us up to date on what's been happening in COVID-19. Thanks, Lori, for coming today.
Hi everyone, I was asked to share with you today the changing ways that the Inn has provided outreach during COVID, and there has been a lot of them. Just as a bit of history, prior to COVID, I just wanted to explain what the Inn has really done practically over the past 10 years in partnering with Central to provide overnight shelter services in the basement at Central United Church 7 days a week over the winter months. And the shelter would open every night at around 6 p.m. and where we would serve a meal to our guests and allow them to shelter until 8 a.m. We also offered, though, a community meal that many of you may be familiar with, and we opened the doors to community meal for those people that were also struggling with maintaining housing, but also maybe in low income. And by coming every night to the shelter for just the meal portion of the services, it allowed them to use their funds that they had to maintain the housing, to pay their rent, to pay their hydro, so that they weren't evicted and coming into homelessness that way. So that was a preventative part of the Inn services over the past 10 years that has been offered. And community meal guests would also have access to clothing that people would make available through donations, to personal care products as well, and then to different programs that were offered to them over the last several years. And after those guests would leave at 8 p.m. at night, then we kept our services open just for our overnight guests, those who were struggling with homelessness that needed a shelter. And at that time, they were allowed access to showers, to laundry services, any clothing needs and personal hygiene needs that they might have, as well as, of course, a warm bed to sleep in, and then breakfast in the morning before they headed out. So those are the services that we have offered over the 10 years. But then COVID hit, as we're all well aware. And when COVID hit, due to social distancing issues and requirements, unfortunately, we had to cancel our community meal mid-March. However, we did respond and adapt to this need, the changing needs, by switching immediately to takeout bags. And so what we did is we were able to find a supplier through a contact of mine that was able to supply a number of frozen entrees. So lasagnas, macaroni and cheese, cabbage rolls, those kinds of things that came to us frozen. And we were able to put those in bags with fresh produce, with fresh fruit and vegetables, with a drink, with a roll that had been again donated to us from our various suppliers. And we were able to hand those out in bags to the community people that would normally come in for a meal. We did that Monday, Wednesday, and Friday. And then eventually that became very difficult to manage. So what we did is we partnered, and that's always a great thing, to reach out to community partners. So we partnered with Grace Cafe. They had also been shut down as far as not allowed to have guests into the cafe, but she as well had adjusted to takeout meals. So we asked if we could partner with her, and she was very gracious, and Ginny began handing out our dinners throughout the week as well. When people came in to get their takeout lunches, they would also be able to get the takeout dinners from the Inn so that they had something to eat at night. So that was a wonderful thing, and we continued going with that until early June, at which point normally our community meal would have stopped, I believe, in April. So actually we were continuing to provide additional services to our community in COVID that normally wouldn't have been there. And so now what we are doing amidst COVID is preparing for the fall, and so we're meeting with the other community meal providers in our community to talk about, and we've already begun meetings to talk about how we're going to meet the changing needs of our community through COVID coming up in the fall with the different restrictions in place. So stay tuned for more details on that. So another change with COVID, the big thing is, thankfully, the inn shelter operations were not affected greatly as far as our overnight services. And public health and the city did allow us to continue with our overnight services with just doing some extra precautions. So social distancing, of course, we've spread out our tables and our chairs. We've put up medical grade dividers between all of the cots in our sleeping area. We've increased hand sanitizing, cleaning, all of our high touch areas. And so with that, we've been able to maintain our services as usual. And our numbers have maintained pretty consistent with our average overnight guests that we did see through the winter, continuing through the summer now. So we serve around 15 guests per night at the overnight shelter. And this does align with our pre-COVID numbers. The other thing with our overnight shelter that is new through COVID is that the city has formed a vulnerable persons task force when COVID began to deal with the issues of what if we had a shelter guest test positive, or we had an outbreak in the shelter, or what if there were other group homes in the city or congregate living situations where there was someone who was positive or an outbreak and they were unable to isolate. Many of us have the privilege of, if we were to become ill or need to isolate, to do that within the confines of our home. Usually we have more than one bathroom, so we can do all those things safely. But of course, our guests and those in congregate living situations wouldn't have been able to do that through COVID. So the city formed a task force and created a protocol that would allow distancing, and they set up some locations that, should we have to respond to something like that, everything is in place with transportation and isolation and medical care and all of those things. So that has been sitting waiting to be used and utilized if necessary across the city, and the city asked the inn to become the lead in setting up that, and also being able to mobilize it if necessary. And so the inn actually became the point of contact for the other agencies and congregate living situations. With just a phone call to the inn and to myself, we have those things all ready to happen and respond. So that's been a huge piece of the work we've done over COVID, taken a lot of time in collaboration with the city, but we're so happy that we're able to provide that service to the entire city of St. Thomas, as well as the inn guests. Another big change and a way we've responded to the COVID needs is through daytime services. A lot of people don't think about when the fast food lobbies were all shut down in March and April, and the public spaces like our library and our arenas and even the Grace Cafe being closed for people to come inside. All of a sudden, those who normally would go to those places during the day, so all the guests at the inn that sleep over would leave at 8 o'clock, and they would go typically to Grace Cafe and sit there for the morning and use the washrooms and receive food. They would go to McDonald's and Tim Hortons. They would go to the library for the rest of the day, and especially during the hot weather to stay cool, and to our arenas. When all of those things shut down with COVID throughout this whole 5-month period, it really did create a crisis for our guests and others that may have housing but may not have air conditioning, may not have access to enough food and shelter and water through the day, those kinds of things. And the other big crisis is restrooms. Our guests had 12 hours in between leaving the shelter in the morning and being able to access shelter at night. And when there were no public restrooms any longer available, that created a crisis for them. So thankfully, again, we partnered with the city, and the city actually asked the inn if we would be willing to open our doors throughout the day to the shelter guests initially. So thankfully, Central United is wonderful at accommodating and being flexible during this time, and they agreed graciously to allowing in early April until for several weeks to the end of May for us to keep our doors open. To provide just socially distanced activities, access to food, access to washrooms, showers, all of those services now that they couldn't access in the community. So that is a way that, with the church's help, that we responded to be able to do that. Then additionally, the city also recognized that beyond the shelter guests, again, there's many people in the community that don't use the shelter but still have issues with homelessness, and don't use the shelter for a number of reasons. They may be sleeping rough, they may be sleeping on someone's couch during the day, but those hosts may not wish them to be there all day, especially now with COVID and the distancing. So there was a gap that needed filling. People that didn't normally use the inn but still needed assistance during the daytime with a safe place to be, with food, air conditioning, and those kinds of things, and washrooms. And so the city also additionally asked us to open up a daytime center, which we did at 423 Talbot, which is the old social services building beside the post office. So again, early April, we began and opened that center, fully staffed with the inn staff and security. And we provided access to washrooms, air-conditioned space, TV, computers for accessing services, telephone availability, as well as food, coffee, water, and most importantly, the support of the staff that comes with the inn, that are able to help people navigate looking up services and applying for applications and different things like that. Eventually, we closed the inn daytime service in May because we recognized those people could easily walk over to 423 and access the services there. So then we just kept everything at one location at 423 during Talbot during the day, and back to the inn for those that needed overnight services. Thankfully, we received a Canada Good Food grant, and we were able to provide continually food and beverages to the guests that needed it. We also have a great relationship with the Beat Patrol officers that you can see now downtown in St. Thomas, that interact frequently with our staff and our guests to help meet the needs of those people. So during this whole time of COVID, from we opened there in April until present, we serve every day there between 20 and 50 people, depending on the weather. Of course, they're not all there at once, and we do maintain social distancing. And now, of course, everyone's wearing masks and paying attention to all the necessary requirements by law. But we are able to still help a great deal of people through the day, and we are seeing with real progress with the people that we're serving. Now, of course, as the public buildings now have begun to open and restaurants and food providers have begun to open, we do decrease our hours according to the different city things that are starting to open up. But we continue to remain open, and we've gotten word from the city that we'll be doing that into the fall. So providing outreach during COVID, as you can hear, has provided a high degree of collaborating, has involved a high degree of collaborating with partners. And this is where I see at the end that we have made lemonade out of COVID lemons, because the heightened awareness of the presence and the needs of those who are homeless in our community, it's really been heightened during COVID. People have noticed that, and because of that, we've experienced increased collaborations among our partner service providers, but also amongst city officials who are really assisting us in responding to our community's needs. And now that we are open during the daytime, we're able to do a lot of things that previously we just didn't have time or ability to do just in the overnight hours that the inn serviced. So now that we're open in the daytime, we are having more interaction. We're helping our guests with assessments, housing applications, working on their ID replacements, connecting to other services, and all of that helps reduce their barriers to housing. And we've also increased meetings where we're taking individual guests and we're discussing them with their consent, of course, and really working in a much more targeted manner and providing them with their needs and hopefully housing. We have seen just through COVID over 10 guests that have been housed that were accessing the services of the inn. So that is great news. So in conclusion, while providing outreach during COVID has been very busy and very stressful at times, it's also challenged us to be very, very creative. We have had to adapt to a drastic decrease in our number of volunteers, but we are so grateful to those few volunteers who have been able to come out and continue to support us throughout COVID with volunteering, with those that have continued to donate both money and items to keep us going, and also those that have been able to support us through their prayers. Central United has been so accommodating and flexible in their support of the Inn during COVID, and we are very, very thankful for that. Together, we continue to serve and to make a difference in the lives of those who need our assistance in our community. And thank you for being part of that.
So in honor of Pastor Paul, and with thanks to Tom Laudebeck for taping all of these events for us over the past few months, I would like to share with you my Hawaiian shirt and to say aloha to all of you. Thank you very much for having us, and thanks to Lori for her expertise and for joining our team last October, because without her we wouldn't be in this wonderful place with lemonade. Thank you very much.